Hello guys, I'm back with another video on cellulite. What is cellulite? How do we get to this cellulite and how do we manage or how do we lose it? Now for those of you who don't know what a cellulite is the dimple-like protrusions or incursions on the skin that happen to be on people who have added weight, fat women and fat men. Those dimple-like incursions that cover the thighs, the buttocks, and some parts of the back. Those are what we call cellulites. And these cellulites occur as a result of course, adding weight and fat. Okay, so cellulite is basically fed also by estrogen. So this is fat cells that have become bigger. They have accumulated a lot of fat and now they're big enough. And then here I've demonstrated a skin diagram that shows the upper part of the skin being the fascia. Then we have the fat cells in between. And then we have the muscles. So these are the muscle cells. So what happens is these fat cells become bigger because of accumulation of fat. Once they become bigger, they overstretch the fascia. The fascia is like a spider web. So they overstretch it. Once they overstretch it, it creates a mesh so that these fat cells pop through. Once they pop through, they create that dimple-like effect on the surface of the skin, which we are referring to as the cellulite. Now, these muscles, now after it has popped out, the muscle cells now hold it outside, making it look like jiggly, and that's why it doesn't look good. It looks like a little ugly, and hence the reason why we want to help you lose it. Now, after getting that, I want you to know that estrogen again is the mother hormone that plays this role. But here we have other hormones. We have 4 hormones. We have growth hormone, we have insulin, we have the estrogen, and we have one called the cortisol hormone, the stress hormone. So these 4 hormones play a major role in formation of this cellulite. And again, these hormones are the ones that when you lower or raise their levels, then you can alter the formation of this cellulite. So we can utilize these hormones to at least lower the chances of you getting cellulite, or if you already have it, to help you lose it. So you can use these hormones as therapy again. Now, how does that form? So we've discussed already the definition of cellulite, we've already talked about the formation of cellulite, and now, basically how to reverse it. Now I already mentioned that these 4 hormones are involved in formation of cellulite. So basically, a lower amount of growth hormone, a high amount of insulin hormone, a high amount of estrogen, and a high amount of cortisol are the ones that are responsible for formation of cellulite. So mark that. And therefore, if you get a chance to increase your growth hormone, then you reduce your insulin levels, and then you reduce your estrogen levels and also reduce your cortisol hormone, and then this cellulite disappears, the skin goes back to normal, and you revert back to normalcy. Now again, pregnancy, multiple pregnancies, once you get pregnant and you give birth all the time, you are bound to add weight. Once you add weight, you also overstretch the fascia and cellulite come through. So pregnancy is another cause of cellulite. And remember, once you start accumulating this fat, they will cause inflammation. Fat is highly inflammatory. So once they cause inflammation, you start experiencing sores. And that's why when you sit for a long period of time, when you have cellulites, you start feeling pain. That is soreness as a result of inflammation. Then again, obesity. Of course, those are like the causes of cellulite. So once you're obese or overweight, then you have high content of fat. And this also exerts a lot of pressure on the skin and fascia. Then menopause. Menopause is a different one because menopause is a deficiency of hormones. So once you have deficiency in estrogen and deficiency of all these hormones that occurs during menopause, then again you have a chance to overstretch your skin. But that one is the opposite of the others. So during menopause, you don't have enough hormones, and that is a problem. So how do you fix cellulite? Now that you understand, we have already this cellulite and you want to fix it. Rather, how do you avoid getting into this? Of course, the easiest way to avoid getting here is to avoid insulin resistance, which means basically you avoid consumption of simple carbohydrates. Once you avoid simple carbohydrates, then your insulin levels in blood start going low, which is an advantage to us. Once insulin starts going low, then now you can easily burn fat. You stop burning sugar, you start burning fat. Now once you start burning this fat, the fat cells are freed and then they shrink. Once they shrink, your fascia goes back to normal because now it's a web and it had created meshes because something like a mesh because of that overstretching, then it goes back to normal. Then your skin takes a normal condition or shape. Now again, these cellulites happen or form within a long period of time, so do not expect them to disappear overnight. So this process has to take a long time also to disappear. Just the same way a fatty liver takes like 2 to 3 years to clear all the fat in the liver, fat cells will take like 8 months to around 2 years to have a complete recovery and a good skin condition. So therefore, be patient with yourself as you exercise these processes. And the first process already mentioned is reduction of insulin. That will only happen. Actually, that is the major one because that you have to lose carbohydrates for you to lose weight. So you have to totally stay away from simple carbohydrates, seed oils, wheat products, all those for you to manage to lower your insulin levels. And again, for you to manage to revert back to normalcy. Okay. Then number 2 is you increase your growth hormone. Remember, a low amount of growth hormone is the one that is responsible for cellulite, for formation of these cellulites. And therefore, if you find a chance or if you get a chance to increase your growth hormone, then you get to clear this. And how do you increase your growth hormone? First of all, you have to keep your liver healthy by eating keto diets. Keto diets means moderation of proteins and high content of fat. Now, most people will tend to confuse that if you eat animal fat or if you eat fat, then you'll keep on adding fat to these cells and therefore you'll keep on having cellulite. That is not true. Once you eat animal fat, you preserve energy. This fat is supposed to help you to absorb vitamins, and again, it is stored in the fat cells, or it goes through the lymphatic system before going into the bloodstream. Therefore, it takes a lot of time before it gets into your bloodstream, and this means you will have reservoirs of energy because fat has a higher energy than carbohydrates and proteins. So you'll have higher energy for your cells to use, and this is energy that the brain cells and the body cells loves, which is the ketone bodies. When you burn fat, you get ketone bodies. So once you consume animal fat, you will encourage the body to know that there's another source of energy apart from sugar, and therefore it will stop burning sugar to give you glucose and start burning fat to give you ketone bodies, which are healthy energy sources for your bodies, for your brain, and also to reduce your chances of getting cancer, because cancer does not survive on ketone bodies. So a highly fat diet is very essential for your increase in growth hormone. Number 2, exercise. HIITs. You actively train intensively for fewer minutes or fewer seconds, then you take rest in between the trainings. And again, heavy lifting. Once you heavy lift, then that means you have energy and you're boosting your growth hormone. Number 3, how to boost growth hormone is sleep. Sleep boosts growth hormone, and also fasting. Intermittent fasting and even prolonged periodic fasting boosts your growth hormone. Actually, 48-hour fasts can boost your growth hormone to up to 300%, and that is important in treatment or management of cellulite. Then, reduction of a hormone called cortisol. Cortisol is the stress hormone. For those of you who don't know, I've said it before. Cortisol is the stress hormone. So this is a hormone that exerts stress to your body and your cells. Now, to reduce cortisol, you have to do certain things. First of all, you have to, again, clean your liver. because this cortisol destroys your muscle cells, it increases your insulin and lowers your growth hormone. So you can imagine it's one hormone but now has a detrimental effect or a huge effect on other hormones. Since it increases insulin, that means again you'll end up in cellulite. Since it drops your levels of growth hormone, again problems. So we want to target increase in growth hormone and reduction in insulin. Therefore, we have to target cortisol hormone, because once you lower cortisol hormone, then you increase your growth hormone and you reduce your insulin. So cortisol, as we said, is a stress hormone. Now, ways to reduce cortisol. Number one, you have to clean your liver. And number two, walk in the sun. Walking and walking in the sun are two different things. So walking lowers your growth hormone, long distance walking, and also walking in the sun lowers your cortisol hormone, because the sun is the major endocrine stabilizer. And the last one is estrogen. So a high amount of estrogen causes cellulite. So now we want to reduce the amount of estrogen. How do we reduce the amount of estrogen? We concentrate on eating nuts for you to get selenium. Now selenium will increase your chances of absorbing iodine. And remember, we said thyroid hormones, once they go up, estrogen goes down. So eat salt, which has iodine, which is the iodized salt. And then eat vegetables in plenty, because vegetables break down estrogen. They have enzymes that break down estrogen and take it back to normal. And then again, eat high content of foods that have iodine and selenium. Those are nuts, and those are seafoods like oysters, sardines, fish, and lobsters. So basically, that is it. So for you to manage cellulite, then you have to only handle 4 hormones. That is growth hormone, that is estrogen, that is insulin, and that is cortisol. And therefore, you have to increase the amount of growth hormone, you have to reduce the amount of insulin, you have to reduce the amount of cortisol, and you have to reduce the amount of estrogen. So basically, that is the therapy. And I've already given you the ways to increase growth hormone and to reduce the other 3. So kindly utilize that and take time, because this will take time to disappear. Be patient with yourself, and at the end of the process, your cellulite will disappear. So thank you, and we'll see you in the next.